So kind of remember that as you guys go out into the world, that people look up to you, okay? So when Dr. Sharman, he's the sports medicine director, he asked me to give a presentation giving the drug talk. I wasn't really sure how to go about it, right? That was a conversation I was waiting until my children were a little older, of course, but here I am. I'm by no means an expert in opiates, but I think any medical provider should have a good basis of what opiates are and the effect that they're having on our country, okay? But I wanted to share a quick clip that could kind of sum up this topic in one video, okay? So we're going to get some help from Bobby Boucher.
Warm LT, welcome. Bobby Boucher, come on, Bobby. Tell me, what is your secret? How do you find yourself in the right position all the time?
That's a good question. What happens is the center has the ball first, and quarterback will say height. That's when the center puts the ball into the hands of the quarterback. So what I'll do is I'll start tackling the quarterback unless he give the ball to somebody else, in which case I'll try to tackle that person.
Gentlemen, it brings me to my next point. Don't smoke crack.
Okay, so this isn't rocket science, right? I've been to medical school, I've sat in too many classes, right? And we talk about the molecular biology of opiates and things, and I'm not going to go into that. We're just going to talk about you and what opiates can do to you, okay? So just a little bit about me. I always like when I was in lectures to kind of hear where the presenter's coming from and why they have the beliefs that they have. So I'm actually from Wyoming. Is anybody here from Wyoming? Wow, nobody. So it is true, right? A lot of people don't even know where Wyoming is, but it is in the United States, okay? Population is 580,000. A lot of people think that there's only like 10 people from Wyoming, but so I grew up in a small town in Cody, population of 9,000, okay? It was a pretty sheltered community. If you do have a chance, you know you guys are here in Utah, you should check out Wyoming. We like you to visit, we don't want you to stay, because we like to have no stoplights in any of the towns. But there's the Grand Tetons, Yellowstone, you guys should definitely come check it out. So I went to undergrad at Brigham Young University. I got my degree in exercise science. I particularly like the sciences, but not so much the exercise. But I also went to, after undergrad, I went to University of Washington where I got my medical degree, okay? So, a lot of differences between Cody, Wyoming and Seattle, Washington, which I'll talk about in a little bit, okay? But here you guys are athletes at Weber State University, right? You guys are trying to excel in every aspect of your life, particularly in sports, okay? So what I want to cover today is what is substance use disorder, what puts athletes or you guys at increased risk of drug abuse and addiction, and what are opioids, and what is this opioid epidemic that everyone is talking about. Okay, you go into the KD hospital and there's narcotic pills all over the wall, and there's this big discussion about opioids, okay? And then lastly, I want to finish with what are the social and medical complications of opiate substance abuse, okay? So sadly, about 8% of individuals aged 12 and over have a diagnosable substance use disorder in the past year, okay, based on the 2015 national survey. So as much as I was joking at the beginning with Bobby Boucher and everything, I mean, this really is an important topic, okay? We can joke about it and whatnot, but really, a lot of people's lives are being affected by substance use, okay? So from a medical term, I'll go a little bit into the medicine. The diagnostic criteria for a substance use is a problematic pattern of use leading to clinically significant impairment, okay? And they list various impairments. So often taking in larger amounts or over a longer period than was intended. So for athletes, right? I don't think any of you woke up this morning and said, you know what, I want to be a heroin addict, right? I'd be willing to bet my life savings on that, though most of it's student loans, okay? But none of you wake up and say, I want to be a heroin addict. But often what happens is somebody gets injured, you go to an orthopedic surgeon, you get your ACL repaired, and they put you on some oxycodone, right? And then all of a sudden, that small amount that they gave you, or even if it was a large amount that you were supposed to take sparingly, all of a sudden, you're still in pain. And you say, well, I'm still hurting, doc, I need another refill. And the medical field is at blame for this too, but oftentimes, what happens? We give you guys another refill, okay? So, you're taking larger amounts over a longer period than was intended, okay? Number 2, a persistent desire or unsuccessful effort to cut down, okay? Number 3, a great deal of time is spent in activities necessary to obtain, use, or recover from the substance's effects. Craving, failure to fulfill major role obligations at work, school, or home, and continued use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by its effects. Important social, occupational, and recreational activities are given up or reduced because of use. You'll hear some athletes' stories about how their love of the sport of football, basketball, volleyball, whatever it might be, was given up because of their love of the substance, right? And I mean, how sad is that, right? I mean, you guys are all here as athletes, and you guys love your sport, I'm assuming, or else you wouldn't be doing it. And then all of a sudden, you can get hooked on a medication, and that's where all your efforts go to, okay? These situations can be physically hazardous, and they can result in physical or psychological problems, and then at the end, we develop tolerance. And then if you stop the medication or the alcohol or whatever the substance is, then you can experience withdrawals, okay? So as a medical provider in the primary care office, often I'll go over adolescents and also, college students over this screen. So, ask yourself this too. Have you ever ridden in a car driven by someone, including self, who was high, drunk, or had been using drugs? Have you ever used drugs or alcohol to relax? Do you ever use alone? Do you ever forget things while you're using? Do family or friends tell you to cut down? And have you ever gotten into trouble when using? So these are questions that I'll ask, and then if they respond to 2 of them, then that means we need to have a little further discussion about what's going on, okay? So just a kind of moment of self-reflection. So again, like I brought up, I grew up in Cody, Wyoming, population 8,000, 9,000. Never really was around drugs or anything. I was kind of in a tight little family. We did cow tipping and that kind of stuff. That was as wild as we got, right? But so then here I am, and I go to medical school at Seattle, right, at the University of Washington. And one of the first books that they made me read was this book called In the Realm of Hungry Ghosts. And it's a book that talks about addiction, and they talk about a community in Vancouver, this small population in the inner city that these people haven't even left, like a mile radius. And he goes through each of their experiences and how individuals would get hooked on heroin. Mom had been on heroin, then they grow up, they get hooked on heroin, etc., etc. And I get put into Harborview, which is a major medical center in Seattle. And all of a sudden, I'm around patients all day who are heroin users. And I'm thinking, holy cow, what is this stuff? And the addiction is so powerful in these individuals that they would they need IV antibiotics because they've got some kind of infection or something. And these individuals won't even stay in the hospital for 6 weeks because of the craving to use heroin. So they would rather have their leg amputated than to stop heroin, okay? And that was the first time in my life where I thought, wow, I was pretty ignorant in Cody, Wyoming, uneducated with regards to drugs, because I would often be judgmental of people that had gotten on drugs, But really, like I said, nobody anticipates getting on drugs. And so you have to be always, ready to say no. If your buddy says, oh, I have some pills, no. And then if you're having surgery, you got to get off the medication as fast as you can, okay? Because this is a real addiction. And again, I can't fathom telling a doctor, yeah, please cut my leg off so I can go home. It doesn't make sense to me, but the addiction is that real, okay? So athletes, talking to you guys, what puts you guys at increased risk? So you guys are driven to succeed, right? How many of you feel pressure from your family to succeed? Raise a hand. Okay. How many of you feel pressured by your coaches to succeed? I think everybody should raise their hand, or else your coach will be mad, right? How many of you want to succeed yourself? Of course you do, right? So, athletics, you have to be mentally and physically tough, right? There's a consumer market, so just like I was talking about earlier, my kids look up to you guys. We like paying money to go see you guys play against, Montana State. And then, you have your coaches and families, right? A lot of your families have maybe invested a lot of money in you. You feel a little pressure like, hey, I better be good at this, or I'm going to live, I'm going to crush my parents' dream of me being amazing or something, But really, you guys are all awesome, and you guys have a lot to look forward to in your life. So, interestingly too, as I was looking up addiction in athletes, sometimes people will say, oh, well, it's the football guys that are addicts, because, or they get into, not addicts, sorry, they get into the opiates because they get the injuries or something like that, or basketball, they have the ACL, whatever. No, the truth is that abusing controlled substances occurs in all sports and all athletic competitions, okay? So, we have performance-enhancing drugs, because individuals want to be better, they want to compete more. And then the biggest one is we want to medicate injuries, right? And we also take medications to deal with mental and emotional stress that comes with being on the field and off the field, okay? So other things that put us at increased risk of addiction: depression, anxiety, ADHD. A lot of times people will maybe feel embarrassed that they have so much anxiety before games or something like that. And instead of going to talk to a medical provider that could help you and prescribe you something that's safe and not addictive, oftentimes we'll try and say, well, taking the oxycodone or whatever makes me feel a little bit more relaxed before the game. Or, if you're having a hard time with school and you're afraid that you're not going to pass to play, sometimes you'll say, oh, maybe if I get some Adderall, that'll help me focus more or something like that, okay? So common drugs abused in athletes: opioids, which is what I'm going to talk about, Adderall, cocaine, alcohol, and steroids, of course. But they asked me to specifically talk about opiates. So what are opioids? It's a class of drug that includes heroin, as well as prescription pain relievers, including oxycodone, hydrocodone, codeine, morphine, fentanyl, and others, okay? So I want to watch a video about an NBA basketball player that struggled with addiction.
In the NBA, he was known as Wonder Dog. In Kentucky, he was known as the King. Now he goes by a title no one would have ever imagined back then.
Hey, y'all, I'm Rex, and I'm an addict.
The sport that gave him a career is ultimately what led him to prescription pain medication. Chapman says years of playing basketball left his body shattered.
I finished playing when I was 32. I had 7 orthopedic surgeries in my last 3 years of playing. And, doctors had started giving me Vicodin, Percocet, Lortab, to, ward off the pain. By the time I finished playing, I had an appendix surgery. A doctor put me on OxyContin, and that was the end. I knew I loved that drug the second I took it.
That tiny pill started nearly a decade of addiction, leaving him broke.
I probably made $40 million playing basketball, and I've piddled it away somehow.
And behind bars.
I always said it. I like to have fun, but I draw the line where somebody's going to take my freedom away from me. I'm not going to go, well, I did that.
In 2015, Chapman was caught on surveillance video stealing from an Apple store in Scottsdale, Arizona. He pleaded guilty to felony charges, was sentenced to probation, and had to pay back more than $15,000. When speaking about his addiction recently, he admits he doesn't even remember stealing and has never seen the video. And now he uses laughter to deal with the shame.
Guys, listen, handcuffs make you look 80 pounds heavier.
By the time Chapman went to rehab, he was taking 40 Vicodin and 10 OxyContin a day.
While I'm driving down there to rehab, I took more Vicodin than I normally did, and I'm on a dirt road pulling into rehab, and I felt myself sort of short circuit, and the next thing I knew I was over in a ditch. I don't know if I was out for an hour or 5 minutes or 5 seconds, but I remember thinking, I need to get in here before I die.
A few months later, Chapman was taking pills again. It took a few trips to rehab before he was able to stay clean. That was almost 3 years ago.
How do you deal with the stigma of it? I mean, everybody knows who you are. I mean, you are more stigmatized than, the other people we've talked to.
When you get in trouble, when you do something wrong, you screw up, you say something wrong, everyone knows, just because that's the world we live in. 24-hour news cycle, the most salacious stuff sells. So that's just part of it. It's going to be part of my present, and it'll be part of my future too. So if I'm going to go through this, I would like to help some people along the way.
And Chapman has returned to basketball, this time using his knowledge.
Okay, so I like the part that he brings up where he says, I'm not going to give away my freedom, but in essence he did, right? I mean, his life became completely turned around. I mean, I can't even imagine making $40 million, over the course of my career and then just piddling it away, like he said, right? All because of opiates, okay? So this is a real thing. So just some kind of wow factor, shock numbers here. So in 2016, so it's just getting worse. 116 people die every day from opioid-related drug overdoses. 42,000 in the year. Let's see. 2.1 million people misused prescription opiates for the first time. Close to 1 million people used heroin. 2.1 million have an opioid use disorder. And $504 billion in economic costs because of this opioid epidemic, okay? So just some more with regards to kind of the post-surgical prescriptions. So surgical patients, of course, are nearly 4 times more likely to get discharged on opiates than non-surgical counterparts, which, makes sense to some degree. But when using narcotics for acute pain, by day 3 or 4, it is more likely that the narcotic is treating pain secondary to withdrawal than the acute pain itself. So kind of interesting, right? We say, I need more narcotics to help control the pain. Well, guess what? Actually, you're treating the withdrawal, okay? So that's why your athletic trainers, your coaches, your physicians will say, get off the narcotics as fast as you can, switch to Tylenol, switch to ibuprofen, something like that that's not addictive, okay? And then each refill and week of opioid prescription is associated with a large increase in opioid misuse among opioid naive patients. That came out of the BMJ, which said that the amount of times even more dangerous than the dosing of the medication. You're better off to be on 10 milligrams of Norco for 3 days than you are to be on 5 milligrams of Norco for 2 weeks. Okay, you're more likely to get addicted the longer you're on the medication. So here's a graph from the CDC showing overdose deaths involving opioids. So the green line is any opioid. So if you add up the methadone, the synthetic opioids, heroin, etc., that'll give you the green line. Okay? So as you can see, that's looking kind of exponential, right? Meaning that it just is getting worse and worse every day. So, you guys are in a tough spot as athletes. I was trying to think, I'm not a big athlete, obviously, because I'm not you guys. But, you guys have pressure that, you get injured, right? And then all of a sudden you have to sit out because you got hurt. Well, what does that mean to you? Well, does that mean you're going to lose your starting position? Does that decrease your chance of, there's a scout there and, this is your one chance to prove yourself. And you might lose your spot. And then there's these magic pain pills, right? That can make you get through the game so that you can impress others. But not only are we artificially numbing our pain, we're not giving our bodies time to recover. So, you keep playing on that injured foot because you're taking opiates, managing the pain, and then all of a sudden your bones or ligaments or whatever is injured is going to get weaker and weaker until you have a real big problem, and then you're out for the rest of the season rather than giving it time to heal. But the bigger concern too is just the fact that the opiate itself can become addictive, and that could mess up your life forever, okay? So 4 in 5 new heroin users started out misusing prescription painkillers. Painkillers fuel growth in drug addiction. So again, none of you woke up this morning and said, I want to start IV heroin, right? No, that's not how it works. It starts slowly, going through misusing prescription painkillers. So I only have a few more slides left, but I wanted to talk, and again, this isn't rocket science, but some of the social implications of opiate use disorder. So disrupted familial and social relationships, failure to fulfill responsibilities at school, work, legal involvement, financial problems, violent behavior, child abuse, neglect, engagement in high-risk sexual behaviors, failure to engage in activities that once were enjoyable. And I think that one at the end is the saddest one, right? I mean, you can't even enjoy hanging out with your family or your friends or anything because you are just so consumed by the opiates. Often perform or are engaged in illegal behavior, shoplifting, burglary, prostitution to obtain money. Your entire day is centered on either obtaining money to purchase the drug or using the drug. Medical complications, so IV drug users get infections. Again, like I was talking about at Harborview Medical Center, people would rather get their legs cut off rather than sit around for 6 weeks and use IV antibiotics. You're likely to get HIV, hepatitis B, hepatitis C, tuberculosis. Opioids also cause severe constipation. That can cause high level of abdominal pain. And you get what's this opioid-induced hyperalgesia, which means people that are on opiates for a prolonged time actually end up having worse pain. So if anybody even just touches you, you're more sensitive to it because your body's been suppressed from feeling pain. Higher rates of motor vehicle collisions than the general population, pregnancy and birth complications, and then of course, higher rates of overdose, trauma, and all-cause mortality, meaning more likely to die, okay? So again, in closing, you know, there's 480,000 individuals that compete in NCAA athletics, okay? The select few will move on to professional or Olympic level. Regardless whether you make it big or you become, you know, an engineer, you go into agriculture, you're a doctor, you're a school teacher, whatever it is, you guys have a lot to look forward to. You know, you got your family, friends, you guys have a lot of things going for you in life. Athletes are great at sports, but they're also great at, you know, you guys are highly motivated individuals. And there's a lot of expectations for you, but I know that, you know, you guys can make a difference whether it's on the sport or, you know, in the classroom. And so don't let opiates or any other, you know, substance keep you from living your dreams and being what you were meant to be. Okay, so with that, that's what I have. If you guys have any questions, I'm happy to take them. If not, no worries.
Why are people going from opiates to heroin?
Sorry, say that again?
Why are people going from opiates to heroin?
Okay, yeah, so the question is, why are people going from opiates to heroin? And the answer is, a lot of people switch. So your question is, why do people, you start out using opiates and then they switch to heroin, right? It's actually related to cost, okay? You know, buying oxycodone on the street can actually get more expensive than heroin, which is kind of surprising to me, but that's a lot of the reason. Anything else? Also, sometimes, you know, they can lace it more potent and that kind of stuff, which is kind of scary to think about. Any other questions? Okay, thanks guys, appreciate it.
Trying to beat me.
See ya. Oh, where's the guy? I don't know how to. Do you know how to turn these off? Yeah. Some guy was.